Hello, this is the first of 4 films that tell the story of my diagnosis with incurable advanced prostate cancer, how I suddenly fell into a deep depression, and how I didn't get any of the right support at the right time. When I did eventually receive psychiatric help, it didn't address the causes of my depression in any way and made my mental and physical condition far, far worse. I eventually recovered despite the so-called treatment that I was given. I've made these videos partly to help me come to terms with what was done to me, to serve as a warning about what can happen if cancer patients are not given timely support, and to expose the failures of the drug-based psychiatry that I experienced, and the negligent and arrogant attitudes of the practitioners of the psychiatry of old age that I was unfortunate to encounter. I didn't give consent, let alone informed consent, to any of these treatments. The doctors told me absolutely nothing about the drugs that I was being made to take. About 3 months after I left hospital, I started to have flashbacks of the forced electroconvulsive therapy. These flashbacks kept me awake at night and made me want to find out what they'd done to me. I found out that I could submit subject access requests and get copies of my medical notes. I now know much more about what happened to me, and I've used excerpts from the notes to illustrate parts of the videos. I've pixelated my face because I'm still working, and not everyone knows that I have cancer. Many of my colleagues and acquaintances would be astonished to learn that I was once seriously depressed and received involuntary treatment. This first film tells the story of my unexpected diagnosis with advanced cancer, to the unexpected solitary confinement for nearly 3 days in a hospital side room, where I was given increasing doses of an antipsychotic and an antidepressant, plus sleeping tablets and benzodiazepines, in addition to the androgen deprivation therapy that I'd just started. This heavily sedated me and made me extremely confused and barely able to function. The second film will describe my confinement at the Royal Cornhill Hospital in Aberdeen, where the forced drugging increased and my mental and physical condition deteriorated further. The third film will describe involuntary forced electroconvulsive therapy with no preparation whatsoever, a totally unnecessary and harmful procedure that was one of the worst experiences of my life. When I got copies of my notes, I found that the doctor treating me had lied on the form requesting a second opinion that was legally acquired, and that the psychiatrist providing the second opinion never met me, and he lied about consulting me on the official form. The fourth film covers the mental health tribunal hearing that ended compulsory treatment, despite the lies told by 2 psychiatrists in their submissions, and it allowed me to begin my recovery. I also reflect on the importance of emotional support when a cancer diagnosis is given, the arrogant attitudes of the psychiatry of old age, and the harm caused by drug-based psychiatry. In late August 2021, I was 65 and about to turn 66. I hadn't been to a doctor for over 35 years, and apart from colds, had no memory of ever being ill. I'd had a happy childhood, led a reasonably healthy life, and had never had any problems with my mental health. Most people would assume that the main symptom of prostate cancer is having to pee more often, particularly at night. I've never had that problem, but I was having dry orgasms and eventually thought that I should have that checked out. I made an appointment to see a GP who took a blood sample and did a digital rectal examination, or a finger up the bum. He was surprised that my medical records were completely blank. He rang me the next morning to say that my prostate-specific androgen, or PSA level, was particularly high. It was over 70, which meant that there was a good chance that I had prostate cancer, and that he would refer me for further tests. There now began a series of appointments and tests, with each notified by separate letter in the post, sent over a period of several weeks. I now know by looking at prostate cancer forums that this is how the NHS usually functions, and that most men find this period extremely stressful. It was already a difficult time for me. I was single, I was living on my own, and I had no living close relatives. My main home was in Orkney, but I was self-employed and staying in an incomplete conversion project in England that I was running out of money and energy to complete. I wasn't eligible for any benefits, had no income, and was living on savings that had dwindled to just a few pounds in my current account because of not working during COVID. I was beginning to worry that I didn't have enough money left in my bank account to continue buying food, let alone to pay bills. I can't remember everything that happened at that time, and I don't really want to, but I do remember having a meeting with a urologist on the 8th of September 2021. He told me that I had cancer, that it was too advanced to be operable because it had already spread to my lymph nodes and bones, and so I would be receiving drug treatment. There was a Macmillan nurse present outside the office, but I don't remember her offering any further support other than giving me her card. With hindsight, it would have been much more helpful if she had followed up the meeting by contacting me after I got over the initial shock of the diagnosis and told me about the cancer support services that are available and about the local prostate cancer support group. More tests followed. I had to drive myself on my own to one hospital 25 miles away for a prostate biopsy, where they fire needles into the prostate via the rectum, and another hospital for a bone scan, and then an MRI scan. During this time, I just about held it together mentally. I received a copy through the post of a letter that the urologist sent to my GP, dated the 20th of September 2021. It didn't contain any new information, but simply put down in black and white for the first time what I had been told on the 8th, that my cancer was advanced and had spread from the prostate to my lymph nodes and bones, and was therefore incurable. Looking back at my emails for that period, I see that I was functioning normally and meeting people throughout most of September. But by the beginning of October, shortly after receiving the urologist's letter in the post, I was starting to fall apart mentally and rapidly became seriously depressed for the first time in my life. I had no income and had business and personal bills to pay. I spent a lot of time in bed, living mainly on muesli. I did try to get help, but I didn't go about it very well. I ended up being taken to the hospital where I'd been diagnosed by ambulance and spent a sleepless night on a trolley in A&E, where I was visited at 4 a.m. by mental health workers with a clipboard and a questionnaire of irrelevant questions. After a while, I told them to go away. I remember one nurse sneering at me and treating me as if I was wasting their time. In the morning, I spoke briefly to another worker before being discharged and having to find my own way home. This is the letter that arrived a few days later, saying that someone from the community mental health team would be in touch, but it might take a few weeks. I had no contact from anyone in the team and didn't call any of the emergency numbers. Why on earth didn't they refer me to a cancer support service instead of mental health for the over 65s? There was no connection made between the cancer diagnosis and my mental state. I had no offers of counselling or treatment for depression, no information about the implications of my diagnosis and how it might be possible to live with cancer for several more years, and no information about support groups and forums. I wasn't suicidal, but I felt that my life was over, and I'd already effectively committed suicide by neglect. I felt that by not seeking help earlier, I had allowed the cancer to become untreatable. Another letter came giving me an appointment with the urology department on the 15th of October, where I would learn about the proposed treatment plan. I didn't go to that meeting, as my cousin and his wife from Shetland were so concerned about me that they came down to England to fetch me. I drove back to my house in Orkney with them following behind in their car. We stayed overnight in Inverness, where we went for a meal in a pub. I was very depressed, but still able to function relatively normally. I'd already registered with a GP in Orkney, and I did get help from the community mental health team. They did their best, but it was practical help rather than any offer of counselling or therapy, or any information about how I could live with prostate cancer. No one reassured me that, as I now know, it's often possible to lead a relatively normal life for several years after diagnosis. My mental health problems and the financial problems that had reached the critical stage because of the diagnosis were discussed without any connection being made to the devastating effect of the diagnosis, or recognition that cancer patients in my situation require particular support. I remained very depressed and felt that the future I had taken for granted had gone. My pension savings were negligible, and before this happened, I had no intention of retiring. On the 16th of October 2021, I had an unexpected phone call from an oncologist in Elgin. I was on my own and in bed at the time. He told me that I had a very serious cancer that needed urgent treatment, and that the average life expectancy for someone with my diagnosis is 5 years. He obviously thought that I might refuse treatment and was trying to impress on me its importance, but the effect was to emphasise the hopelessness of my situation. He told me that I must start androgen deprivation therapy to control the cancer. The letter from the urologist in England had told me that the cancer had spread to my bones, and I continued to believe that the cancer had spread throughout my body and that my health would progressively decline until I suffered an unpleasant death, until around 3 months after the phone call from the oncologist, when I met him in person and learnt that the cancer had spread to some lymph nodes, but not to my bones, and I learnt more about the proposed treatment and the prognosis. On the 20th of October, I began a 4-week course of bicalutamide tablets to suppress the testosterone surge that would happen when I began to have injections to stop testosterone production. The tablets were dispensed by the local GP, who also prescribed some antidepressant tablets which I didn't take. On the 18th of October 2021, I had the first injection of triptorelin at the GP surgery. This is androgen deprivation therapy or chemical castration, and the sudden loss of testosterone can itself cause depression and other side effects. Close monitoring of patients who are already depressed is advised, but this didn't happen. The injection is a gel that's injected into my buttock and releases the drug over a period of 3 months. My cousin remained worried about me and suggested that I stayed with them for a while. Their son came down and escorted me to their house in Shetland. This was the start of the Shetland winter and my mood remained very low. I was beginning to suffer from the frequent severe hot sweats caused by the androgen deprivation therapy. Although my mood was low, I was functioning relatively normally and eating regular meals with them. On the evening of Friday the 26th of November, 8 days after the injection, my vision became blurred and for a short time I went completely blind. I was very frightened and thought that I was having some kind of medical incident like a mini stroke. I clearly remember going into the living room where my cousin and his wife were watching television and telling them that I couldn't see and asking them to call a doctor or take me to A&E. They didn't take me seriously and said that it was too late to do anything that evening, which made me very agitated because I couldn't see anything clearly and they were ignoring me. This agitation included pacing up and down, going outside to get some air despite the rain, and going into the bathroom opposite my bedroom and pacing up and down there. I still don't know what caused me to temporarily go almost blind that evening, because it was never investigated. I remained convinced that some kind of medical event had occurred. Much later I found this list of possible rare but serious side effects of triptorelin, which seems to include a description of exactly what happened to me, on the RX website. It advises that it should be treated as an emergency. I was also deficient in vitamin B12, perhaps because of the cancer or my diet, but this wasn't corrected till I had a series of 6 injections in hospital in Aberdeen. Symptoms of B12 deficiency can include vision problems, depression, and not feeling as hungry as usual. I'll never know what caused me to go temporarily blind that evening, because no investigations were ever done. I'd started wearing glasses earlier that year, and the optician had referred me to the hospital where I was diagnosed with bilateral glaucoma a couple of weeks before I learnt that I probably had cancer. The cancer diagnosis overshadowed any thoughts about my eyes. My hospital notes record my concern about blurred vision weeks later, and I'm now effectively blind in my left eye. Perhaps if I'd received prompt treatment, I would still have some sight in that eye. On the Saturday, my cousin did agree to phone their GP, and who warned the hospital to expect me. He drove me the 35 miles to the hospital in Lerwick to get checked out. I remember him being mostly silent during the journey. Although I knew absolutely nothing about it at the time, I now realise that he must have told the GP that I was acting strangely, and not that I was worried about losing my vision and wanted this to be investigated. I expected to be checked out for the episode when I'd lost my sight the previous evening. Nowhere in any of my notes does it say the truth, that it was me who asked to be taken to hospital to be checked out. They say only that my cousin had taken me there because I was behaving oddly. My cousin simply dropped me at the hospital and left me once he saw that someone was attending to me. I remember the feeling of turning around and seeing him slowly walk away, leaving me on my own. I felt that I'd been deserted. I'd expected him to stay with me to support me, to take me back to their house after my checkup, not to abandon me. They gave me some standard tests, but no investigation of my vision or investigation of why I'd temporarily lost my sight the evening before. I was very depressed and hopeless, and accepted what was happening to me rather than challenging it. I remember being interviewed by 2 psychiatric workers who happened to be in the hospital on a Saturday. I remember being asked to do what I now know is the mini mental state examination. This is used to test for cognitive impairment, particularly with Alzheimer's. I scored 25, which is not perfect, but within the 24 to 30 range for no cognitive impairment. I was also asked many questions. This is the first time that I'd spoken to anyone in any detail about how I felt. Unfortunately, this wasn't just a sympathetic chat, and I now know that they believe that I've been taken to hospital because I was acting strangely, so perhaps I should have said less to them. They took lots of notes, and it led to a diagnosis based simply on their opinion, rather than any scientific tests. Gross overtreatment with multiple psychiatric drugs that took away my ability to think clearly, and the unexpected loss of my liberty for the next 2.5 months. My notes say that I was trying to get into a shower fully clothed on the evening when I became agitated because my sight had gone, but this is completely untrue. I went into the bathroom opposite my bedroom while I was agitated because of the blindness, but had no intention of taking a shower. Now that I've seen my notes from the Aberdeen hospital, I see that their discharge letter amplified this myth and said that I'd actually taken a shower fully clothed. I hadn't expected to be admitted to hospital and didn't want to be admitted. I'd never been in hospital before. I was wearing old work clothes and hadn't taken anything with me. I don't remember much about my time in hospital in Lerwick, as I was so heavily drugged that I was barely able to function, and everyone seemed a long way away, as if viewing them at the opposite end of a tunnel. I was kept on my own in a prison cell-like room. The nurses were quite unpleasant to me at times, and I remember having a cannula in my arm that bent at right angles as it caught on the bedclothes and bruised my arm. I was worried that it would become infected, but no one checked it. My cousin dropped off a bag with some unsuitable clothes, and rather than giving me my phone, gave me an old pay-as-you-go phone that needed the code to unlock it, which I didn't have. So I was unable to contact any friends or clients for the next 5 weeks. The handwriting on my medical notes is difficult to decipher, but on Sunday the 28th, the day after I was admitted, they include ongoing worrying and not taking a reassurance about his physical health, and medication reviewed and increased, becoming more agitated, had managed a full evening meal and is engaging very slightly in conversation, pacing the room, accepted 2 milligrams of diazepam. I certainly wasn't psychotic before I was admitted to hospital. I was depressed and had become anxious about the physical symptoms that I was experiencing. They didn't seem to consider the possibility that the drugs and unexpected confinement on my own in unfamiliar surroundings caused the symptoms that they interpreted as psychosis. On Monday the 29th, the psychiatrist's note include seems more and more psychotic, now saying he has died and someone else has taken over his life. The nurse's notes made at 5 o'clock in the morning say Jay was found in the corridor, disoriented and distressed that the belongings in his room did not belong to him, and stating that someone had swapped his life for someone else's, given 2 milligrams of diazepam. Later that morning, the nurse noted that I had been incontinent of urine and hadn't noticed. I was given 100 milligrams of sertraline. I was told absolutely nothing about the drugs that I was being made to swallow, and certainly didn't give informed consent. Now that I've seen my notes, I'm incredulous and angry that they so massively overdrugged me, when I'd never taken any kind of psychiatric drugs before. The drugs records in my notes are difficult to read, so I've combined them into a table that shows the increasing doses and drug combinations given to me over the 3-day period that I was there. I was already on a slow-release dose of triptorelin. This is androgen deprivation therapy, and as well as hot sweats, many users report having extreme fatigue, mood swings, and other unpleasant side effects in the early weeks of treatment. The Mayo Clinic website says that sertraline is one of the medicines not recommended to use with triptorelin. The drugs, as I now know, were sertraline, antidepressant, with the dose up to 3 times the normal starting dose in 3 days. Drugs.com says that dose increases should be made at intervals of at least 1 week. The next drug was olanzapine, which is so-called antipsychotic or major tranquilizer. It's a heavy-duty drug usually used to treat schizophrenia and bipolar disorder. The manufacturer's information leaflet states that it can be used with Prozac for treatment-resistant depression, which is defined as adult patients who do not respond to 2 separate trials of different antidepressants of adequate dose and duration in the current episode. So it should never have been given to me as a first treatment. And if it was, the dose should have increased gradually rather than by 3 times, from 5 milligrams to 15 milligrams over a 2-day period. I don't know whether it's now licensed to use with sertraline instead of Prozac, but the literature that I found suggests that it's an off-label use. I'll say more about the effect that olanzapine had on me later. Zopiclone was given for sleeping, which when combined with the other drugs probably accounted for my drowsy state. A According to the NHS website, it has some rare side effects, including experiencing delusions and hallucinations. At 5 a.m, after being given zopiclone and olanzapine before bed, I was found wandering in the corridor. Diazepam was changed to lorazepam because it was not tolerated. I don't know what was meant by that, but once again the Mayo Clinic lists a drug interaction and says that it's not recommended for use with olanzapine. However, it's commonly prescribed to treat the anxiety caused by antidepressants. Before leaving Lerwick, I was given 4 times the intended dose of lorazepam, as I described later. Drugs.com says that the dose should be increased gradually to avoid unwanted effects. The Mayo Clinic says that its use is not recommended in patients with depression or psychosis. It seems that I was going completely crazy and the drugs were making me genuinely psychotic and deepening my feelings of hopelessness. Before starting androgen deprivation therapy, I'd never taken drugs of any kind. As far as I can remember, I'd never even taken aspirin or paracetamol for colds. So why the hell did the psychiatrist prescribe this mixture of drugs for someone who had had no drug treatment before and who became depressed for the first time in his life 2 months previously when he was told that he had terminal cancer? Why give a drug combination intended as a last resort treatment when other drugs have failed as the first treatment? And why didn't they recognise that my worsening condition was because of the drugs and not because of worsening mental illness? This heavy overdrugging and unexpected deprivation of my liberty and solitary confinement far away from home and any contact with anyone who knew me, and abandonment by the cousin who had relied on to help me, made my mental and physical state much, much worse. I could no longer think coherently and could barely stagger from bed to toilet. I wasn't suicidal, but the experience reinforced my despair that my life was over, as I had in effect committed suicide by not getting help for the cancer before it became incurable. I remember in my drugged state seeing someone in the distance reading out some official language, which must have been the temporary detention order, imposed apparently because I was hesitant about being transferred to Aberdeen. Now that I've seen the psychiatrist's notes, it seemed that I agreed to the transfer, but then said that there was no point because it was too late. Rather than try to convince me, they took out a detention order that meant that I was to be detained in hospital and treated against my will. The Code of Practice for the Mental Health Care and Treatment Scotland Act 2003 states that any medical practitioner giving treatment for mental disorder must take the views of the patient into account, and the patient should be given information and assisted to understand the treatment and its aims and effects. As I'll explain later, my views were never taken into account. I was not given any information about the treatment, and the order was later used as a legal basis for giving me forced treatment against my will. I remember a nurse with a heavily made up face sitting near the end of my bed, ignoring me and chatting with another nurse about how she was looking forward to a shopping trip to Aberdeen. I clearly remember a particularly sadistic nurse putting tablets into my mouth followed by a cup of water while he laughed and wished me a pleasant journey. If I close my eyes, I can still see his face now. I see from my notes that 3 1mg tablets of lorazepam, in addition to the 1mg that I'd already had that morning, were prescribed for possible use during the journey if I became agitated. He decided to give me all 3 tablets before we set off, making a total of 4mg, to heavily sedate me for their own convenience. I'd also been given 150 grams of sertraline, which is 3 times the usual starting dose, and 2.5mg of olanzapine that morning, and 3.75mg of zopiclone for sleeping during the previous night. I have no memory of the journey by road and air ambulance. Drugs.com states that using lorazepam with sertraline may include side effects, including drowsiness and confusion. Hallucinations are listed as possible side effects of lorazepam. My notes from the Royal Cornhill Hospital say that the journey was uneventful, but that I was hallucinating when passing through the baggage reclaim airport at Aberdeen Airport. By the time I arrived in Aberdeen on Tuesday the 30th of November, I was completely off my head with drugs, no longer capable of rational thought, and convinced that my life was over. The discharge letter sent from the psychiatrist in Lerwick to a consultant in old age psychiatry in Aberdeen said that my condition seemed to have deteriorated. He repeated the untruth that I'd been taken to hospital because my cousin was concerned about odd behaviour, and said that my presentation suggested a psychotic depression, when I was never psychotic before I entered hospital. It said that I was distressed with nihilistic delusions when I'd been told that I had incurable cancer and that my life expectancy with treatment was around 5 years, and distressed because I had unexpectedly lost my liberty and was being held against my will far away from any familiar places or people, and because I was so heavily drugged that I could no longer think coherently, and was much, much more depressed than I had been before.